Doc on the Run. We help injured runners run.
So the obvious question is, how do you tell if the metatarsal bone is stable enough to put on compression socks without making it worse? Well, my thought on this is pretty simple. If you can press on the metatarsal bone and it doesn't cause any pain, you can definitely apply compression socks without any significant risk of further injury. Now, if you barely press on the metatarsal bone and you have a lot of tenderness, then it just stands to reason that it's going to hurt when you shove your foot into a tight compression sock and you have to wiggle and writhe around to get the sock on over your foot. The first thing to think about is whether or not the stress fracture is a minor sort of early phase stress fracture, or if it's really a significant stress fracture that means you have a truly broken bone in your foot. The second consideration is timing. Even if I were to tell you you shouldn't wear compression socks because you have one of these unstable types of metatarsal fractures, it's not going to be that way forever. After a couple of weeks of healing, you start getting some stability in the bone because you start getting little strands of collagen healing all around that fractured area. It's usually somewhere around 2 or 3 weeks that people stop having discomfort when they push on the foot or they move it around. Although it may not actually be safe for you to walk on it or go for a run at that point, you could probably put on compression socks. And even though you aren't yet completely healed, if you look at your foot, you will notice that even 2 or 3 weeks after the injury, you're probably still having a lot of swelling. So once you're well into the proliferative phase of wound healing and a metatarsal fracture becomes stable, it can be effective to use compression socks to help force that fluid out of your foot and keep your healing on the fast track. Now, you also have to keep in mind that even after you're back to running, the remodeling phase of healing goes on for months. Some medical textbooks tell us that it can go on for up to a year and a half. You still can get some swelling during the remodeling phase. So even after you get back to running, I think it's a great idea to use compression socks to prevent the accumulation of inflammation that can freak you out and make you think the metatarsal stress fracture has returned. When it comes to other types of running injuries, you can basically apply the same principles to help you decide whether or not you should use compression socks. If you get the socks on with lots of discomfort, then you should probably just keep them on. But if barely moving your foot is really extremely painful, then it seems unlikely you could put on the socks without risk of more tissue damage. If it's painful when you apply compression socks and you get them on, then generally speaking, I think you should leave the socks on for several days before you remove them. Any benefit you might get from compression could be undone by all that motion of putting them on, taking them off, if you don't give it several days to start healing. Now, there are some running injuries that are more straightforward in terms of deciding whether or not you should use compression socks. Applying compression socks seems to put more tension on the structures on the top of the foot than it does to structures on the bottom of the foot. The plantar fascia is the largest ligament on the bottom of the foot and possibly the structure in the foot most commonly injured. By some accounts, plantar fasciitis accounts for nearly 40% of all visits to podiatrists in the United States. In the book I wrote on runner's heel pain, you may have learned about the other conditions like bursitis and calcaneal stress fractures and even a partial rupture of the plantar fascia, which can all cause similar symptoms to plantar fasciitis. Although these conditions all involve different structures, they are all on the bottom of the foot. So in general, if you have pain on the bottom of the foot and you're worried that you have plantar fasciitis or a stress fracture in the heel bone or bursitis underneath the heel, compression socks are a great idea. Even if you have a partial rupture of the plantar fascia, there is very little risk of further tissue damage with any of these conditions when you're using compression socks. If you have swelling at the base of the second toe and you think you have a plantar plate sprain, compression socks can really help reduce that inflammation as well. If you have peroneal tendonitis or posterior tibial tendonitis, compression socks can be hugely helpful in reducing the inflammation. You just have to make sure they don't have a lot of tenderness when you're applying the socks. Ankle sprains are another common injury affecting runners. An ankle sprain can really swell up, but the same sort of rules apply here. If you have a lot of tenderness when you're putting on the socks, you should leave them on for several days. Don't take them off and on over and over because you just might do more damage to the injured ligaments. If you have a lot of tenderness, it may be safer to simply wrap the foot and ankle with an ACE wrap as your initial form of compression. Then, once it is healed for a few days, you may be able to get the socks on without so much risk. And that brings up another point. One way to tell at the outset how much tissue damage you have is based on the amount of bruising you see. Anytime you have a bruise, it implies that you did some sort of significant tissue damage. Either you cracked a bone, tore a ligament, ripped a joint capsule, or split a tendon. But whatever you did, you had a significant injury, enough to cause bleeding under the skin, which you see on the surface as a bruise. So if you have a running injury and you see a bruise on your foot or your ankle, then you may want to think twice about wiggling that injured foot into a compression sock. So, Should you wear compression socks if you have a running injury? Well, as I said, it depends. But now you understand the basic thinking behind my decision-making process when I look at a runner in person or through a webcam during a virtual doctor visit. Just use a little common sense, and when in doubt, get help from an expert who really understands running injuries. Do whatever it takes to get back to running as quickly as possible.
Doc on the Run. We help injured runners run.